Hi, I'm Dr. Saylor with Van Every Family Chiropractic Center, located in Roanoke, Michigan. And here we're with Caitlin, and she's going to tell us a little bit about your story here.
Yes, so I came to Van Every Family Chiropractic when, in the fall, it was about October. I attended a baby bumps and beer bellies seminar, workshop, yeah, exactly. And, I was 6-7 months pregnant at the time. I was experiencing some rib pain, some lower back discomfort, and I'd been familiar with Van Every's name because I've come to the Kids Day before in May with my toddler, and years ago I came with my sister who took my niece here for her child ID kit. So I was aware of the place. Good family friend comes here, and I thought, maybe it's worth it to see what chiropractic care can do for pregnancy, because I've never been to a chiropractor when pregnant. I've gotten adjustments before when I had a little tweak in a neck or a little tweak in a back, but nothing as a regular component to my wellness. Okay. So I attended the seminar. I even got my husband to come with me, and I thought, wow, it really seems like there's a lot of benefits, and it can even do things to kind of help my body prepare for the miracle that we call childbirth. And then it would give me a free newborn screening as well. So I thought that was great because the labor in itself is almost a trauma for the child. There's a lot of moving parts there. So I started coming, and I started getting regular adjustments. In December, January, I took advantage of the family week. I got my husband and my 3-year-old to come in and get checked out and do their exams. I thought the whole exam process, the thermal rollers and looking at the test was amazing. To look at it and see, yeah, no, that is right. That is kind of where, this part of my neck, that is where I have a little bit of a pain or a twinge. And so just kind of seeing how things make sense in terms of how I'm feeling and what the exams are showing. Okay.
And how did you do through your pregnancy then?
So during my pregnancy, I came for regular visits, and it really helped me with that rib pain. Everything was just all right up in my belly and really tight. So each week I, was able to kind of get some comfort, and as I would come back and get to that comfort level again. And then the baby would keep growing, and I would keep coming back for adjustments.
Okay, so let's tell us about Amelia a little bit.
So Amelia is going to be 4 in August. So she started coming when she was about 3.5 in January. She came, got the exams done through the family week. She's very high energy. Maybe sometimes has a little bit of some sensory processing issues. So I thought, I watched the videos on your testimonial page about how, it can help children, and I know you guys have done some of the workshops for the, children with ADHD and sensory processing issues. And I thought, it's worth a try to come in and see, how she does. So when she first started, she was very, very tight. So you would try and adjust her, and she'd be like, or she'd try and, kind of lean all over the place. So Dr. Ann, Dr. Ashley, nobody would really be able to touch her. So I would have to try and kind of hold her up and do a little bit of adjustments. But as she kept coming back and became more familiar with you and Dr. Ashley and the staff, and coming for all the kids clubs each month where there was a different little thing, getting the sticker, getting the prize, she started to get excited to come and see all the doctors. And now she can actually, she's either playing with a toy or she's drawing on a whiteboard, and she's just in normal posture, and she's able to get it adjusted in at least half the time of what it was for the first one.
And she loves coming. And
she
so
loves it
happy
every time. And we'll be in the car, and she says, I'm going to go get an adjustment. The chiropractor, which comes out, it sounds like tractor. Go to the chiropractor.
Okay, and then tell us about Jocelyn.
So Jocelyn is now 5 months. She came in when she was just 2 or 3 days old. Got her very first adjustment. Noticed, some alignment issues, like maybe the hip and the shoulder, and so, kind of got all that stuff squared away, and came in for the first couple weeks, probably about twice a week, and then kind of more into once a week. And between my first daughter being a baby and Jocelyn being a baby, I just noticed more of a chill, happy, a little bit more, advanced in terms of meeting some of the milestones, starting to roll over at 3 months old. She also had the torticollis, so the neck, the tight neck muscles. So all of the adjustments and everything, I could notice. And now, she's more of that midline. I mean, there's still a little bit of the tilt, but there's just immense progress. And I feel like the chiropractic care is maybe helping prevent some of that colic. And
'Cause she's
my
so
first
happy.
daughter, I'm sure had the colic because it would just be, long periods of the screaming and crying. And I was just so surprised because, of course, every baby can be different, but she really is just a happy baby, and just, she smiles right through her adjustments. And I mean, sometimes it is harder with some of the neck stretches that we do for the torticollis to, in the beginning to kind of get everything loosened up. But I mean, she's just a very happy baby, and she's trying to move all over. She's already trying to get her legs up to crawl, and I mean, she's just ready to go.
Okay, and Kyle's getting adjusted?
Yeah, Kyle's my husband, and he started in January as well with my older daughter. He sometimes has issues with his back or sometimes like his leg. So, he's had adjustments over the years past, and they seem to have helped, but at a certain point, he just kind of got, like, oh, this is never going to get better, and I'm just going to deal with it. Well, I was like, you really should. I know we've tried other chiropractors, and his brother-in-law is a chiropractor. He's got his own business in Seattle. And I thought, well, let's see what you think. I thought that the exam process was really interesting. I showed him my scans and, how it identified certain things. And I thought, what's the harm in at least coming to get an exam? You can get an exam, you can get an adjustment, and if you want to keep going, you keep going. If you want to stop, you stop. And he has seen really great improvement.
Awesome.
And so, I mean, all of us are very happy.
Okay. And what one thing would you want everybody to know about Van Every, I guess?
The people are just great. The staff at the front that are helping you come in, the doctors that are adjusting you, the staff that are doing your initial examinations, everyone's great. They'll do whatever they can to help you. I can call like that morning and say, hey, I know I didn't make an appointment earlier this week, but things freed up or our schedule changed around, can we come in today? Or we had a couple times where we were going to come in and we got a call from my mother-in-law that her car broke down. And, it's an hour before the appointment. And I've had to call and say, hey, I hate to do this, but can I move the appointment a little bit later today? Or can I move it to tomorrow? We've had something come up. We've got to make it switch. And not once did I ever feel like I was a burden to them. They completely understood. They were very willing and flexible to help me, and they just treat us like family. It's so nice.
Well, thank you. Okay. Well, there you have it. So we treat you like family too. So everybody have a great day. Bye.
Bye.